and today I have the pleasure of doing an interview with Dr. Rossella Nappi from Italy. I'm so happy that she is here. She is the current president of the International Menopause Society, and she's going to talk to me about all the important things that women need to learn and focus on to make sure that not only they have a great transition through menopause, but also that they're healthy at other stages of their life. So thank you so much for joining me. I really appreciate it.
Yeah, it's very, very nice to be with you and Rosella. And I'm professor of obstetric and gynecology at the University of Pavia in the north of Italy. And it's more than 35 years I work for women's health from adolescent to menopause and beyond. And really with this perspective in the life cycle according to a biopsychosocial model, because we really need to consider that there are so many determinants of women health and reproductive health, not only hormones and organic factors, biomedical condition, but also our mood, personality, experience, the partner, the social environment, the climate change, even, and we really need to consider women's health as one health, the woman, the environment, and the society, and all the things that they are surrounding us.
Hmm. Okay, so tell me about the International Menopause Society. Why is that an important thing for women to be aware of?
International Menopause Society, it's really an international organization that is dedicated to provide the best evidence and equitable care for women across every angle of the globe. Uh, and this is very important to do, because menopause is a biological condition, very natural. But the way we go through our menopause, it's very, very variable depending on the genetic, for example, on the lifestyles of different areas of the world. As you can imagine, there are some countries like the US, Canada, Europe, UK, Australia, in which it's really a priority in women care since so many years, whereas there are other countries, let's say in Asia, in Africa, and other areas of the world in which is not a priority because there are so many other very important aspects of women's health. Think about in Africa, we still have maternal mortality, anemia, and people they die earlier, and therefore they do not consider so much the so-called healthy longevity. Okay, but it's true, however, that as you know, life expectancy is increasing in every part of the world, even though in some countries it's still lower in comparison to Europe or North America. But now the government and especially the policymaker in terms of women's health, they understand very clearly that if you do very well focused consultation for women in the window of opportunity of the menopausal transition, you don't only care for women in terms of improving their quality of life and well-being, helping them to recognize that some symptoms are linked with this transition. Because women, everybody knows that hot flashes, they come with menopause, but there are some people that do not understand that you may have some mood changes, sleep disorders, joint pain, other symptoms, even gastrointestinal symptoms or other aspects, allergies, for example,
Hmm.
and other symptomatology, brain fog. It's really related to menopause, okay? And this is very important for every doctors, not only for OBGYN, because one thing it's really part of my, let's say, mission, because every president, when take over the society, try to find a team that help to develop an educational program, both for healthcare provider, but also for women, because we have a wonderful website in which we target the healthcare professionals in order to update them on all the last breaking news and best evidence studies on what you have to do with women, hormones, not hormones, new drugs, etc., etc. But also we have a section to inform women because there is a lot of fake news out there, you know. There is a lot of merchandising of menopause nowadays. You sell everything in name of menopause, but a lot of this stuff are not evidence-based. So women, they really need to be informed of what is evidence-based, what is safe, the risk and benefits, because to treat menopausal symptoms, it's a choice, you know, it's not a surviving issue. You know what I mean? So you really need to make a trade-off sometimes. What is good for your health, what is bad, what the right testing that you should do, because you don't have to waste money following all these new ideas of anti-aging, longevity. You know, there is a lot to do in order to improve the way women at this particular they see at this particular time of their life, because we don't have to go against the aging process. Okay, we really need to embrace a new chapter of our life, and to do so we really need to be well prepared and understanding that every day we can do a little thing that help our health, because menopause is like a portal, you know, that you open, and according to your genetic, according to your lifestyle, and according to your healthcare system that offer you some preventive strategies or not, the possibility to have health insurance, the possibility to have facilities in your working place, because there are some working environment in which, you know, you may propose to women to do preventive care, and this is reimbursed for you, is a benefit, and therefore this is fantastic because you have all in one day. You can do a lot of very good testing, etc. But there are other women that don't have. So we really need to empower them to know what they can do by themselves. And as you can imagine, it's not only healthy eating, you know, but we know that some kind of diet, for example, Mediterranean diet, can help you very much, avoiding ultra processed food, etc., etc. This is for symptomatology, because if you exercise, you can, and you eat well, you can gain a lot. And also teaching to women some tips and tricks, for example, to maintain restorative sleep, to try to learn how to relax a little bit. You don't have to take, let's say, the best course in the world of meditation, yoga, etc. You can learn very simple tricks in your life that can help you. And you know, avoiding alcohol and smoking. This is something we always say, but also to explain to women that this should be done across the entire life. And it's not a question you should not do it, but we really need to promote a culture. Do it good, not avoiding, because as you know, this is behavioral medicine. Because if you say to somebody, please stop smoking, she will not stop, okay? But if you say, you know that women, they do not smoke, they breathe better, they look better in their skin, etc. This is behavioral medicine, and you really trigger a positive change, because human beings, they don't like prohibition, you know. And but if you promote this, is very important. And also a very important dimension, it's really, you know, also to explain to women that sharing their menopause experience is crucial. It's very important with the partner. It's very important with your colleagues. It's very important in general, because you don't have to feel ashamed that you are menopausal. You don't have to feel that you are aging, that nobody wants you anymore, because this is crucial for another very important dimension, that is emotional and mental health. Because women nowadays, as you know, our life is completely changed because we were working in the house, taking care of the family, but now we're working outside. We are doing so much in our life. And sometimes women, they are overwhelmed. They feel uh, a lot of pressure on themselves. They want to be perfect in everything they do. But, this is not possible, as you know.
Yes.
And by sharing experience, and it's like, and even with your partner, you cannot play tennis at 60 years of age as you were playing when you were 30. So we really need to teach women and to help them to find into their life experience the resources to cope with this change. And maybe sex is different, but it's different also for him, and there are many different experiences. And if you are in a second marriage, of course, this is revitalizing, okay?
Right.
But if you have the usual husband since 35 years, of course, sex should be different. All this kind of thing and sharing the experience is very important to keep the balance, because nowadays, what is relevant for a women's health, remember, is the balance. Because if you are able to control the stress system, we know that this is very positive for many different medical conditions. And I don't know if you know, there are so many very important non-communicable diseases that are related to obesity, overweight. But, we really need to help women to, how I can tell you, that is not a quick fix, that you don't have. It's like anti-obesity drug. Of course, they are useful. I'm also an endocrinologist and they can help, but it's not the only solution, because this is a shortcut that doesn't help you. You really need to put the drug into a wider context, You have also to change. And it's the same with hormones. There are women, they are taking hormones like elixir or youth, but this is not real, of course, hormones, I'm a hormone believer, I'm a reproductive endocrinologist, but you really need to use regulated hormones. You don't have to use products they are compounded, because you never know the quality of the product, the safety data, they are not so good. All these information are very, very important to empower women, and also to teach women to recognize a good menopause doctor, okay? And a good menopause doctor is not only focusing with a bikini view, breast and uterus, okay?
Right.
This is not a woman doctor.
Mhm.
A woman doctor is a doctor that understands that hormones, they are have a widespread role for women's health, from the tip of your hair to the tip of your feet. And therefore, every organs, every system in the body, the cardiovascular one, the neuropsychological one, the bone health,
Right.
because if we want to keep an healthy longevity, we really need to keep our bone and muscle in good shape, and we really need to promote the health of our body to promote the health of our mind, and vice versa. And this is something that you can do with very simple exam, as you know, testing glucose, controlling cholesterol, blood pressure, and doing the good prevention, and trying to focus the attention on the different vulnerability, because women, they're not the same. Every human being is unique.
Mhm.
And another very important point, it's really to help women to understand that if you enter menopause early, before the age of 40, or prematurely before the age of 45, or as a consequence of surgery, or even worse, as a consequence of chemotherapy, radiotherapy. So when you have malignancies, this is even that's harder for women. And so we really need to counteract the consequence of this early or traumatic menopause, not only with drugs, because sometimes we cannot use hormones.
Right.
And this is the reason why we really need to stimulate women to learn different strategies. This is the key message. I think you have received the material from Mitle and the staff. We have Claire, the staff we have at IMS. Have you seen the leaflets? They are very beautiful. All the material we have. But for women, it's really, in essence, it's very important to understand not a disease. It's a natural period. I have to embrace that. It's the doctor will do something for me for sure. So you really need to go to see a menopause doctor that has let's say, a multidisciplinary approach to woman. So you should not see problem in a vacuum, but always with an holistic approach. And we really need to find the vulnerability of the individual woman, because not every woman, there are women, they are just happy to enter menopause because they don't have migraine, they don't have menstrual cramps, hemorrhagia, they don't fear, they don't need a contraception anymore. You know, so many different things. So we really need to do a good counseling and a shared decision-making process. What we can do for your menopause. What do you need really? What do you want? What do you prefer? And there are some women, they are a very, very clear idea, while other they are let's say, they are not in power. So they are undertreated because they are afraid. They don't understand the importance of these 10 years in your life between 45 and 55. It's really crucial for your life in the future.
Wow, that was amazing. Thank you so much for sharing all of that. My question now is really about the women in countries that don't have the same level of healthcare that we have, like you said, in the UK or in Europe or the US or Canada or Australia. How does the International Menopause Society help women in those countries?
Absolutely. This is very, very important question. First of all, remember that we really need to educate the healthcare provider.
Mhm.
We are providing them a lot of material and teaching to start some microsites. For example, I went to Kazakhstan. I went to Middle East. I went to some area of Africa because there are some doctors, they need guidance. But we also need to exchange with them because our model is not their model, okay? And therefore, we need to understand. Let's say, for example, Asian women, the first symptom of the menopause is not hot flashes,
Hmm.
is joint pains. So we really need to focus our attention on that. Then we produce some recommendation and guidance that we can translate into different countries. So we produce a master document, let's say, and then with working group in the different countries, even 10, 15, 20 doctors, we adjust the guideline to that particular country. And in this way, we can approach the health care system in order to promote a better care for women. And we are doing this now, for example, in Middle East. And this is amazing because if you think about, if you do this in countries where women's health is not a priority, you improve gender policy
Okay.
because and gender equality as well, because I understood this, my dear friend, the day I went to teach menopause in Saudi Arabia. The president of the Menopause Society, you know what he told me? He told me, listen, Rossella, we understand this point on sexuality, etc., but remember that we change our wife. We keep that wife, but we have another girlfriend. So for us, it's less important. I say, yes, but for women, it's not. And so if you teach to women from different areas of the world that keeping your physical health, think about the vagina, the health of the vagina, the dryness, the sexual pain. And this is very important because if your husband doesn't want you anymore, okay, that's fine. But this is for you, and this is very important. And so we're trying to approach really the healthcare system, and we are doing also a little bit now of pharmacoeconomy, because you really need to understand that by doing something at menopause, you save money for the future. Keep in mind you can prevent fracture. Fracture, they are associated with morbidity and mortality, but we really need to work also with statisticians, with people that maybe they are not really doctor, but they are in preventive program with the FIGO, International Federation of OBGYN, the WHO, the Lancet Commission for Women's Health, all these associations that want to partner with us, and also McKinsey, we approach them, because this is very, very important to widespread the message that if you introduce some policy for menopausal women, you can increase, first of all, gender equality, the role of women in the working place. You can promote the culture of prevention, and you can decrease major events in medicine, fracture, myocardial infarction, stroke, by doing something. This is the next step, to try to translate what we know into real action for changing something, and let's say you do a bone scan. There are some countries in which you don't do a bone scan. And if we propose that, for example, we have data on breast cancer in those countries in which you don't do a prevention every year or every 2 years or every 3 years, according, you find that maybe less cancer because they die and for other reason, but also when you find cancer is more advanced stage, and so you will die from cancer. So by using the number that come from really the government, like you have in the US, we have in Italy, on the number of events and how we can cut these events. This is really something. So doing menopause as an international expert is really more than taking care of hot flashes. It's really changing our attitudes towards women in general, and women's health should receive the same attention. Gender medicine is very important because diseases, they are not the same in men and women. And women, they are not aware they die from cardiometabolic related disease. So they always think about breast cancer. Breast cancer is very important. We really need to save life of women still in some countries, but we really need also to sensitize women that they really need to do cardiovascular prevention, that it's not for male, it's their disease, it's their problem. Because in the US, for example, following 65 years of age, more women have events, cardiovascular events, and they die from cardiovascular events more than men, because the prevention in men, we know since a long time, primary prevention, whereas women, they don't know. And what they should know, that is with menopause that you have to start, because you lose the estrogenic protection that is there to protect the pregnancy, because the pregnancy is the most important stress test that you have in your life. And this is the reason why women, they have estrogen, because they should adapt their body to the request of the pregnancy in terms of every system of the body. So when you don't have estrogen, if you have some kind of vulnerability, depending on your family history, depending on your genetic, depending on bad attitudes, etc. Think about sleeping. Nobody knows that if you don't sleep enough, you develop more cardiovascular events. So this is really the real thing. Little things every day to change. And you really need to think to the woman, but also on large scale to the role of the woman in the society.
It's a really big job you have. Hats off to you for trying to not only change women's minds around this because there's a stigma of shame and silence,
Yeah,
but also
exactly.
trying to change doctors so that they're, educated so that they can help women, and then changing the men on top of that. And then,
Yeah,
the societal changes like you touched on that come from that. This is a big order of work that you are doing. So
we are a nice group coming from different countries. This time is my time. I'm Italian, but last president was from Australia. The next one will be from Singapore. Was from the UK. I mean, we are trying to represent the different areas of the world, and we hope to increase the membership. And this is the reason why we have a lot of program, also discount for low-income countries, and we are trying to, because we are a charity, remember, so we really reinvest whatever we gain from big meetings, etc., into education facilities for those people that cannot afford. And I'm investing very much on the empowerment of women as well. And now we have, as you know, we have so many social influencer, all these people, they reach millions and millions of people. But unfortunately, sometimes they are not doing a good job. They are good influencer and bad influencer.
right.
So we really need to grow as a society and to become influencer in some way. And it's not easy because if you have scientific data, people that don't like, they prefer to have Holly Belly or, Michelle Obama talking about the menopause.
Right.
But if we instruct Michelle Obama to say the good thing, this is very important. And so for me, I don't care. I care about women, okay? Because women women is life. Women is it's really important to care as a doctor, but also as a woman working for other women. And this is it.
Oh, Rossella, I love that. Okay, so tell me about the website. So you said that there are menopause specialists, there are providers that are listed on the website. There's information on the website. Tell me about
Exactly. And then we have a menopause info. Menopause info is growing, and we have different languages also. It's very important. All the material is translated in many, many, many languages, not only the most important one, but we have Chinese, Japanese, Hindi, or whatever. And on the website, you can be connected. You can see videos, and we have a material for doctors and for women. We always try to go hands in hands, with a plain language to improve health literacy in women and more scientifically based for healthcare provider.
that.
So it's really, and it's free for women, of course, and it's free also for doctors. But then, for example, if you want to have the material that we publish every month in our journal that is named Climateric, of course, you should be a member of the society. But there is a lot going on, and you can find easily. Our website is internationalmenopausesociety.org, and it's very, very well received. We have a lot of free teaching on YouTube, and even women sometimes they follow our webinar, and we do a monthly webinar on a very different topic. we are making partnership with other website of other society, for example, International Society for Incontinence, Sleep, World Sleep Society, migraine, trying to make a community also of website dedicated to women's health. This is very nice as well. So this is the future. This is my mission. Multidisciplinary approach and health literacy uh, being underdeveloped countries.
Wow. All right. Well, thank you so much for joining me. I'm just so
Thank
grateful
you,
that you're
Shawna.
doing
You're
the work that
so
you're doing.
great.
Elevating women, lifting women up. The more women that can do that for one another, the better off this planet is going to be. So I
We
really
really need to
appreciate
be
it.
sisters in menopause.
That's right. That's absolutely right. All right. Thank you so much for joining me. I know it's a
Thank
late hour
you.
there in Italy, but I really, really appreciate it.
Ciao, ciao,
Ciao,
ciao.
ciao.
Bye bye.